Hi everybody, Dr. Chris Ludwell again. Just want to take a minute to talk to you about a symptom that I see in my office quite often that about 80 to 85% of our population deals with, and that's low back pain. But I don't only want to talk about low back pain, I really want to talk about a symptom that's associated with low back pain, and that's called sciatica. Now, I have my friend here, Fred, so we're going to pull Fred off. So we're going to look at the spine, okay? Sciatica can be caused by several different issues. We're going to talk about two different issues today. The first one we're going to talk about is sciatica that is caused from a disc-related issue. Okay, so the disc-related issue is going to be, there's an old term that you call a slip disc. Discs can't really slip, but what they can do is they can herniate. So when we see our herniated disc, let's start with the normal view. This will be a normal disc. It's contained. Okay. Then we're going to move to a bulging disc. Still contained, it's not touching the nerve yet. And then we have the severe one. This is a herniation, meaning that the disc material inside the disc has come out and has contacted the nerve. And that's where you feel a lot of your sciatica symptoms, which goes down the leg. And people who have had sciatica know exactly what I'm talking about. So a disc-related issue with the sciatica is normally a surgical case. So the neurosurgeon would go in and they would possibly do maybe a discectomy and remove that material and get it off the nerve, and your symptoms would be gone. Okay, so and there's other surgical techniques they can use, that just depending on the surgeon that you talk to. Now, another issue that can cause sciatica is from a muscle. So we're going to act like this tape is going to be the muscle. This is a very specific muscle called the piriformis muscle. It's attached to the inside of the sacrum, okay, and it'll go out and attach itself to the outside of the femur. This muscle is actually one of the external rotators of the hip, okay? So a large percentage of the time, the sciatic nerve will traverse through this muscle. So if you have Piriformis Syndrome, you will have sciatic issues. Now, again, it may not be from a disc. So if this is a muscle issue, this is a little easier to treat than the surgical case. So say we do have sciatica from the piriformis muscle. What we're going to do is we're going to do some very specific stretches and rehab to try to alleviate that symptom. How do we look for these things? When we're talking about a surgical case, if it's coming from a disc, we'll have to take an x-ray, possibly an MRI, and that will tell us exactly what we need to do. With that same x-ray or MRI, if they're negative, then we know that we're probably dealing with a piriformis issue, and then we know that the rehab will probably work for us. So when we get into the piriformis issue, when you come in the office, I can give you some stretches and some rehab to do. So if you or anyone you know that are dealing with sciatica issues, just give us a call at Southern Plains Medical Center, 405-224-8111.